Good afternoon, everyone. My name is Andreas Ekvall, and I'm a Senior Climate Officer at Healthcare Without Harm Europe, and I'll be presenting during this workshop on developing mitigation targets and science-based targets. Please note that this session is being recorded and will be available on this page shortly after the workshop ends. And if there is time, I will try to address your questions during a Q&A. Otherwise, I will try to send you a message after the end of the workshop. Today, I am very excited to introduce our newly developed resource, Healthcare Leaders Handbook for Setting Decarbonisation Targets. This is the first comprehensive handbook for developing mitigation targets and science-based targets for the healthcare sector. As a whole, the handbook contains a common framework for developing mitigation targets while providing recommendations on the design of a first mitigation target, thereafter progressing to describing how to develop more advanced targets and how to monitor and measure progress. Today, I will specifically cover how to design a mitigation target and how to develop more advanced science-based targets. We hope this resource will support you in building a net zero future for your healthcare organization, supply chain, and of course the communities you serve. The handbook has a place within our carbon management journey, which is designed to move healthcare providers from calculating to managing carbon footprint. And if you are new to carbon management, I highly recommend that you follow these visualized steps. I have placed the handbook in step 5, which focuses on developing plans to reduce greenhouse gas emissions. The target setting handbook is also a complementary resource to our 4-part healthcare decarbonisation toolkit, specifically part 2, a step-by-step guide to carbon management, and it strongly relates to step 4, which is target setting. Step 4 is also our starting point today. Step 4 specifies what the mitigation target is, and it is a quantified time-bound commitment to reach a specific greenhouse gas emission level. Crucially, it should primarily be driven by direct emission reductions and complemented by carbon removals to strictly address any remaining residual emissions. Think of targets as serving 2 core purposes. First, it is a strategic tool defining the timing, scope, and scale of action required to reduce emissions in line with a defined target level. Second, it functions as a guide for organizational decision-making, prioritization, and investment. If well designed and executed, it gives healthcare leaders the clarity needed to move onto a pathway of deep and sustained emission reductions. However, mitigation targets are not just about reducing emissions. They offer extensive benefits. So let's have a look at a few of them. First, it's about honoring healthcare's mandate by setting targets that align with healthcare's ethical principle, do no harm, and by transitioning to zero emissions, we proactively reduce climate risks. It fundamentally acts as a vital form of harm prevention. Second, we unlock powerful healthcare benefits. Interventions targeting energy, transport, and food systems deliver immediate and localized returns. These include reducing air pollution, promoting healthy diets, improving physical activity, and ultimately lowering the burden of disease. And third, it allows us to advance climate justice. A clear target honors the Paris Agreement by enabling well-resourced organizations to decarbonize rapidly, while also enabling other healthcare systems to grow, ensuring access to healthcare. And finally, a mitigation target serves as a strategic institutional anchor. It acts as the core around which the carbon management plan or climate action plan is designed to achieve. The starting point for target setting and what you should strive for to achieve is the Paris Agreement. It's a legally binding agreement ratified by 194 states, which was designed with the objective of holding the global average temperature to well below 2 degrees and pursue efforts to limit temperature increase to 1.5 degrees Celsius. When we discuss developing credible and ambitious targets, we should strive to set targets that are a fair contribution to the achievement of the Paris Agreement. The Paris Agreement was a very important milestone, but the question that lingers is whether we have made sufficient progress since its ratification. And we have not reduced emissions sufficiently. We are fundamentally raising the clock to limit warming to 1.5 degrees. Emissions needed to peak by 2025, but this was not the case. Globally, emissions are increasing, which is reducing the carbon budget, or rather the volume of emissions which we can emit while staying within the Paris Agreement. If we continue to emit with the same policies, we are headed to a world that is 2.8 degrees warmer. This will have tremendous consequences for both the environmental and social systems which the health sector depends. However, what the table indicates is that if funding, knowledge, resource sharing, and ambitions increase, the likelihood of achieving the Paris Agreement increases. Consequently, climate action across the world needs to increase significantly, and a key component is developing mitigation targets that reflects the required ambition. I'm now going to move over to Chapter 2 in the handbook, which introduces a common framework for understanding and developing mitigation targets. This chapter is essential as boundaries, climate commitment, and our understanding of climate targets vary across the healthcare sector. And this lowers the credibility, enables greenwashing, reduces comparability, and stakeholder insights. And most importantly, it results in emission reductions that are not in line with the Paris Agreement, nor with the world that we want to build. So, how do we design targets aligned with the Paris Agreement? Our framework breaks down the process into 4 essential building blocks. First, we have target boundaries. This is where you define what is included in a target. Second is the time frame. This involves identifying the starting point and when the target should be achieved. Third is the target level. Here you specify the emission reduction that is to be achieved. And finally, we determine the target types. This entails outlining the target, or rather how the target is structurally expressed based on its unique boundary, time frame, and target level. These 4 steps are iterative and interdependent. They interact strategically and often overlap throughout the target setting process, as we will see. So let's look at how we establish our target boundaries in line with the Paris Agreement. For healthcare institutions, activity coverage is the scope of organizational operations, entities, and value chain elements that are included in a target. But depending on the target's purpose, the scope of inclusion will differ. For organizations wishing to set organization-wide targets, which are known as headline targets, all organizational components should be considered. But targets can also be set for specific emission categories. These are known as subcategory targets. Then the boundaries should capture the activities you want to measure and reduce. Additionally, your target should fully encompass all greenhouse gases outlined in the revised Kyoto Protocol and beyond. Beyond these boundaries, we need to consider that real emission reductions should always be prioritized. These should be aligned with an economy-wide emission reduction of at least 90% by 2050. And we also need to think very granularly when we are setting targets. It is recommended to set additional targets or rather subcategory targets focusing on health, high-impact areas, and short-lived climate pollutants such as methane. Now, let's look at the element of time frame. Targets are more than just aspirational statements. They are concrete commitments tied directly to an organization's short and long-term strategy. The time frame itself defines the depth of planning and the scale of action required. And setting an effective time frame always starts with 2 key dates. The first is the base year. This is a historical year of emission data that serves as your benchmark for tracking of future progress. this year must represent typical standard operations, avoiding any unusual disruptions that could skew your targets. Second is the target year, or rather years. These are the specific future points by which your continuous emission reductions must be achieved. As you can see on the timeline below, these target years are often structured as a series of progressive milestones. You begin at your base year, moving systematically towards short, mid, and long-term targets. Now, let's look at how we define the target level. This represents the core of our ambition, typically expressed as a percentage for reduction by a specific target year. These target levels can normally be sourced from climate science, recognized institutions and standards, and of course, government regulation. To see how this works in practice, we can look at the science-based benchmarks or examples of target levels, which are set relative to our 2019 base year. The short-term targets outline an immediate action for the next 5 to 10 years, requiring a 43% reduction by 2030. Midterm targets act as the critical bridge between your near-term and long-term vision, pushing a 60% reduction by 2035. And long-term targets lock in your ultimate net zero date. This must be achieved by 2050 at the very latest. Finally, let's explore target types, or rather how we structurally organize our targets. If it is your first target, I recommend establishing a single headline target across multiple target years. For the structure of the target, I recommend an absolute target, which commits your institution to reducing its emission by a specific amount by each designated target year. This absolute reduction is always set relative to your historical base year. But this is only one type of target. In the guide, we cover 5 types of targets, such as intensity targets and supplier targets, or supplier engagement targets. My second recommendation is that you combine headline targets with detailed subcategory targets. This dual approach provides you with the clarity, or rather the overview of your emission efforts. And it also provides you with the granular information about specific emission categories where you need to take action to reduce emissions. So let's tie all of these pieces together and develop a target or a mitigation target following our recommendation for an initial mitigation target. Step 1 is to define your target boundary. Your scope should be comprehensive. You should encompass your whole organization along its value chain. For the emission coverage, this means including all greenhouse gases. Step 2, you need to establish your time frame. You start by selecting a base year, and from there you map out your short, mid, and long-term milestones. Step 3 is to determine the target level. Here, I recommend committing to a concrete absolute reduction, leaning either on the climate science, governmental regulations, or standards. And something that is crucial in this step is that you incorporate a neutralization cap. This means that the use of carbon removals must be limited. We recommend a maximum of 10% of your base year emissions, and these should be reserved exclusively for residual emissions, and these are the emissions that remain after all possible actions have been taken to reduce emissions. And carbon removal is, in short, the process of removing carbon from the atmosphere for long-term storage. You can read extensively, or more extensively at least, about carbon removal in the guide, but it is beyond today's presentation to go through it in depth. Now, building on the framework developed in Chapter 2, Chapter 3 in the handbook focus on how to develop more advanced targets that are aligned with the climate science. Here you can see 3 best practice examples from the handbook. They give us a great look at different scale of operations. We have a national health system, a regional health trust, and an individual hospital. Together, these institutions offer practical guidance on how you can use more advanced methods and tools to develop targets and track progress. These healthcare institutions also represent some of the most forward-thinking healthcare organizations out there. And I do want to extend a big thank you to the Health Service Executive, Newcastle Hospitals, and the Maria Health Foundation for their contribution to the handbook. Now, while all of these are committed to net zero, they each use different boundaries, methods, and targets, or target levels. And this really highlights a broader challenge when it comes to mitigation targets. There is currently no single unified framework for setting targets across the European healthcare sector. We are facing a regulatory gap. Broader rules like the European Union's climate commitments or the Corporate Sustainability Reporting Directive do often not trickle down to an individual level of a healthcare system or hospital. While there are national and regional healthcare systems that have policies for targets, they are still outliers. And because of this gap, facilities that are less advanced in the carbon management journey often struggle to set targets that reflect the ambition of the Paris Agreement. So, how do we amend this gap? Well, we need to move towards a more unified framework and towards more advanced targets across the healthcare sector. And in developing more advanced targets, the first thing we must understand is that science-based targets are not just a distinct category of targets, they rather represent a method for setting and developing targets, following the latest climate science. By utilizing specific climate scenarios and pathways consistent with limiting global warming to 1.5 degrees or well below 2 degrees, these targets end up becoming Paris aligned. When moving towards more advanced targets, we have to remember the guiding principle that the pathway is paramount. Advanced targets are designed to really front-load emission reductions in line with the climate science, driving deep, immediate decarbonization in a healthcare facility. And this ensures that you're actively shrinking your carbon footprint every single year in line with what is required to meet the temperature thresholds in the Paris Agreement. Importantly, simply making a public commitment to reach net zero by a far-off date is no longer sufficient. What truly matters is your mitigation pathways, or rather target trajectory. The specific year-over-year pace and scale of emission reductions that you take to reach a net zero status. This leads us to what a net zero status actually entails. Within this ambition, there are three distinct types of targets an organization can set, or rather target levels. The first is a zero emission target. This is the highest form of commitment. By 2050, absolutely no emissions from the institution, from any activity, across any scope. And this state is reached entirely through emission reductions, not using any carbon offsets. However, in looking at the healthcare sector, it may still be medically justified to release certain emissions in 2050. And in those cases, the right path is probably to set a net zero target. This entails still you have to drastically cut emissions or reduce them by at least 90% by 2050. And only after this, residual emissions should be neutralized using high quality, long-lived, permanent carbon removals. The third is a net negative target. This advanced commitment requires an institution to move beyond a neutral balance, reaching a state where its verified carbon removals actively exceeds its residual emissions. Crucially, this target must be achieved through rigorous permanent removals. Now let's look how we actually set and develop target trajectories aligned with a net zero status by operationalizing the climate science. To start, we need to understand what a climate scenario is. And essentially, it's a data-driven description of the future based on distinct assumptions about technical and socio-economic developments. These assumptions are processed through complex models to project how human activities will lead to emissions and subsequent global warming. These models gives us pathways that will keep the world inside the Paris Agreement. When it comes to applying these pathways, there are two primary methods. First, the contraction approach, and this is a uniform model where every organization follows the same target trajectory between a defined base and target year. Essentially, everyone works towards the same reduction and reduces emissions at the same pace. Second, we have the convergence approach. This method uses a sector-specific scenario, usually focusing on physical intensity or a physical intensity unit. You'll find a few examples of what this can look like in the handbook, but an example of a physical intensity level would be that a hospital might set a target to reduce its emission per patient. When we talk about aligning our headline targets with the Paris Agreement, the global best practice is to use the contraction approach based on the Intergovernmental Panel on Climate Change C1 scenarios. These are highly ambitious pathways designed to limit global warming to 1.5 degrees by the year 2100. And by hard-coding these benchmarks into our target levels and years, we ensure our institutional targets mirror the exact pace and demand by the climate science. However, we have to acknowledge that these global scenarios were developed around the year 2020, and many of the underlying assumptions have not been realized today. Consequently, when deciding on a scenario for your organization, you must critically evaluate its feasibility. And first, we use the mitigation hierarchy. This means enforcing a zero emission priority. Absolute reductions should be aligned with reaching zero emissions by 2050. And if zero emissions cannot be reached, we follow a net zero priority, verifying that the scenario follows a 90% reduction through emission reductions and that any planned carbon removals stays strictly within a 10% neutralization cap. Furthermore, we need to analyze the technological feasibility. If the scenario relies on carbon removals, as an example, its growth parameters must be supported by estimates from recognized authorities. Second, we choose a pathway that results in no or limited overshoot. Temperature should remain at or safely below the 1.5 degree temperature threshold before the year 2100. Third, we need to assess the socio-cultural development. And here we focus on the underlying assumptions of the scenario. We choose a scenario that are aligned with a vision of the future and reduces impact on human development and fundamentally has a positive impact on human development. And finally, your target levels and your target trajectory should be developed to be equal or to exceed the ambition of the scenario. So let's look at how we structure targets, align with the demands of the science, specifically focus on our framework in Chapter 2. For headline targets, your overarching targets must include greenhouse gas emissions across all scopes, and they should be strictly aligned with a 1.5 degree climate scenario. Your subcategory targets should focus on the areas that deliver health co-benefits while aggressively reducing emissions within high impact categories. Third, for the target levels themselves, they should be mapped out following the climate science, which dictates rigorous reductions. So here I would recommend phase target levels and with specific milestone target years. And fourth, we implement a strict neutralization cap. And fifth, we recommend integrating a carbon budget. This means complementing your target with a cumulative multi-year emission targets to ensure a science-aligned contribution to the remaining global carbon budget. Let's talk about subcategory targets. In the handbook, I've split these into two core areas: targets that accelerate health co-benefits and targets that directly drive healthcare decarbonisation. By setting targets that accelerate health co-benefits, we can leverage the health argument to really motivate change. It also makes the benefit of climate action feel more tangible. These targets do more than just reduce emissions. They can directly improve the health of local communities and lower operational costs. We also recommend to set targets that directly accelerate healthcare decarbonisation. Focus on high impact areas or emission categories with a lot of emissions and where you have operational control. And this typically includes supplier engagement targets, or rather focus on the supply chain, though we also recommend focusing on medical gases and inhalers. I do want to reflect on the latest trends that I'm seeing as well. And we have been seeing, or we are seeing, increasing recommendations that are focusing more on alternative indicators or KPIs being used to both calculate and reduce emissions. And an example here would be our volume target for suppliers. And I would argue that this is essential for the healthcare sector. We all know that Scope 3 is the elephant in the room. It is immensely complicated to accurately calculate and measure emission reductions from Scope 3. And what alternative indicators gives us is a practical way to decarbonize Scope 3 without perfect data. And when you successively implement these alternative indicators, they can still be reported as a major win and can be a powerful driver for change. Additionally, we are seeing a rise in the use of sectoral climate scenarios to develop subcategory targets. The Science Based Target Initiative provides some really good examples here. But by looking at these scenarios, you can map out the exact timeline and scale of emission reductions required for different emission categories. And I do think that this will be one of the biggest trends moving forward. Looking at the time, I think we have unfortunately come to an end of this workshop. But I do really want to emphasize that I hope that this guidance really will help you to build a net zero future, and you can reach out to me if you have any questions. I will also try to look through the chat and answer any questions. And I do, of course, invite you to keep the conversation going, of course, via the chat, or rather connect directly with your fellow attendees via the platform. Once again, I want to thank you for joining me for this workshop. Coming up next at CleanMed Europe at 16:30 CST, we'll have another workshop, Delivering Climate Commitments Through Sustainable Healthcare Practices. Following, stay tuned for our session announcing our European Sustainable Healthcare Award winners, which will begin at 17:15 CST. Many thanks, and we hope you enjoy the final hours of CleanMed Europe 2026.